Today we have two cases for comparison. They share some findings and each have a special finding. So let's start. The first case is 71-year-old female A&E patient fell down 10 steps. This is the 71-year-old male, 71-year-old female fell down 10 steps. Okay. There is comminuted distal radial fracture which extends to involve the wrist joint. So it is intra-articular extension. There is intra-articular extension. A comminuted fracture which extends to involve the wrist joint. So this type of fracture has intra-articular extension. It's not extra-articular fracture. Because this fracture extends to involve the joint, the wrist joint. Okay? Also there is dorsal angulation and radial displacement of the distal fragment. There is dorsal angulation. This is the dorsal aspect of the hand, and this is the palmar aspect of the hand. So this fragment, this fractured distal fragment has displaced dorsally, and also the fractured fragment has displaced towards the radial aspect. This is the ulna and this is the radius. This is the radial aspect and this is the ulnar aspect. So there is dorsal angulation and radial displacement of the distal fragment. Dorsal angulation and radial displacement of the distal fragment. The management here is orthopedic review. So let's start the second case here. 35-year-old female A&E patient alleged assault. Okay. Had a fight. This 35-year-old female, adult female with a history of alleged assault. There is a comminuted distal radial fracture which extends to involve the wrist joint with intra-articular extension. Can you see this? This is the fracture, okay? There is irregularity here and here, irregularity in this cortex and irregularity here also. This means that the comminuted distal radial fracture has extended to involve the wrist joint. So this fracture has intra-articular extension. There is no angulation or displacement of the distal fragment. Okay? This is the fracture with no angulation, no dorsal angulation as seen here. Okay? No angulation or displacement, radial displacement, no displacement, only cortical irregularity, no angulation or displacement of the fractured distal fragment. There is associated fracture of the ulnar styloid. Can you see the fracture line here in the ulnar styloid process? This is the normal ulnar styloid process and this is the fracture line. So this is There is associated avulsion, fracture of the ulnar styloid process, associated fracture of the ulnar styloid, and soft tissue swelling. There is soft tissue swelling. And the management here also is orthopedic review. So that's all for these cases.